Surrounded by the Western Ghats and the Nilgiri Biosphere Reserve is the beautiful city of Coimbatore. And in this quaint little city, there is Ganga Hospital where our year-long journey started. Like little birds, we migrated from all over the country to this temple of medicine. So what do? We optimize patients in the pre-op and Mr. Anesthesia in the theaters and also take care of them in the post-op. We sometimes stare at the numbers on the monitor, but now and then we also take a peep outside at the stunning scenery. Divinum Seder Dolorum. It's divine to alleviate pain. Yes, that's us. Sometimes we try to make sense of the heart's beating, and on other days we take a peep at the nuances of the brain. We have a lot of academics, of course, morning ICU seminars, rounds at 11 a.m. sharp, polytrauma rounds on Fridays, and a lot of work in the ICU. Let's not forget the RNA, where unstable patients are resuscitated before shifting to OT, and on arrival blocks at the block room, concepts very unique to Ganga. Finally, a well deserved cup of filter coffee to end the day at work and chit chatting endlessly. That's not all. We have Saturday classes on regional anesthesia and the mandatory gala breakfast post class. We also have master classes and innumerable workshops to hone our skills better. All work and no play? Definitely not. We celebrate our festivals with pomp and fanfare. We also find excuses to hang out. And now and then, we also let our hair down when need be. Let's have some fun. Famous dialogues as heard in the ICU. Okay.
Not going to run marathon tomorrow. You want to cancel the case, take the machine count. You want to continue the case, take the manual count.
Why do you want to waste time autoclaving the implants? The patient is already running a fever. He's taking the autoclaving himself. You need a microscope to see that bleed in the city. You may rather ignore it.
If this has to get infected, no, probably spit on it. Nonsense.
Personalities and experiences united by trauma.
And blind leading to blind always.
Yeah.
We all have our highs and lows, but what really matters in the end is how well we bounce back.
Like this was my best decision, whatever I like to come to Ganga for my fellowship. Previously, I was thinking about in Bangalore and all, but finally I got here. I came here then after coming here, like clinically, everything, my way of thinking, approach to the patient, everything has changed. Currently, I'm in West Coimbatore and also South Indian coffee definitely. Ganga made me to think actually, in both in clinical aspects and also made me to improvise in many things that I would follow in my future also. And the other things I usually miss this place and my friends. That is the most thing that is worried. I don't know how it takes, but I miss you guys.
So I was told by a very wise person, one of my seniors, that after your undergrad life, it's very difficult to find friends. You'll only have colleagues at that point onwards. I was proven completely wrong after coming to Ganga by having a great set of people. Although the number of hours that we all are working here, it was quite long and sometimes it does get tiring. We always had people that we can walk to at any point and talk our hearts out, bitch about each other, and let down our sorrows and be have a shoulder to cry on.
It has been a wonderful year actually here in Ganga with all the colleagues and friends coming from different parts of India, getting to know each other. I will definitely miss all the handworks. Even though my life continues in Coimbatore, it will not be the same.
So here, over the last 6 months, we just found that there's so much more to trauma than what meets the eye. More than knowing what to do, we learned what not to do.
I'd like to thank my fellows for the constant source of my entertainment. Very different kind of personalities. I remember this friendship throughout my life.
Two things I've learned. One, how to think, and two, this is maximum I've learned
In a year.
in a year. And I also miss this group. It's a fun group, and each of us with different personalities adding flavor to what the flavor to the night. So thanks guys for being who you are and making this year wonderful. Actually, there was lots of things going on in my life, both professionally as well as personally. So professionally, for sure, I've learned a lot of things. Even though it is it's like a second part of my career. Like after pediatric anesthesia, I've come to trauma and I've learned a lot of things. And professionally also, personally also there was a lot of things going on. Thank you so much for being with me. It was very, very supportive and very nice year.
Let's now finally hear from our mentors, teachers, and people who have stood by us all along.
Binayak asked me to talk about fellowship and what I consider the value of the fellowship and the fellows. And I have to trace back the history that when we started very small, 2 surgeons and 1 anesthetist and 1 SHO. And gradually, as we picked up volume, it became mandatory that we need to have more people, one. And secondly, how do we get that more people? Do we get it in the form of staff or in the form of training? So we understood that if we have to be a teaching institution and if we have to improve ourselves, then it has to be a form of teaching and training. I think that was very important. So we boldly set up fellowship programs. In fact, Ganga Hospital is one of the earliest hospitals where fellowship programs were created, and paid fellowship programs were created. You need to think, what's good in Ganga Hospital. So you not come here to see what's bad in the place or what's the bad things in your teachers or something like that. You only have to look what's good in them. You think you need help, please have a low threshold for seeking help. Okay, that again is very important, particularly in anesthesia, because the distance between difficulty to desperation to disaster is not too much in anesthesia. So the earlier you act in this thing, and there is a honor in seeking help. And again, so all of us have to have some pride in the place. You need to have very pride in your family. You need to make Ganga Hospital proud. So if you are a fellow here now, and then when you go back 20 years later, now you do something fantastic, you're there, then you could still know you were there with us one day. Okay, that's very important. Okay, so good luck. I think it's a great place. We enjoyed having all the fellows. In fact, I always tell them we love our anesthesia. Okay.
The aim is, what we thought was, we should give a comprehensive management of patients, including pre-op, intra and post-op care. So that way, at least you have everything, regional anesthesia, general anesthesia, whatever type of blocks you want to give. It just gives you a complete picture. That is our focus of this course. And over the years, now I also realize that different people's expectation is different, and not everyone has the same expectation. Some will go back into practice in a private setup or in a corporate setup. Some will go in for a research work or academic work. So in the ongoing process, what we want and our colleagues planning is to get into sort of a individualized. Each one should have an individualized plan for the training. So hopefully at the end of a year or 6 months, there should be in sort of a complete picture of anesthetics. We can handle everything, right from ordinary cases to emergency cases. So that should be our aim and focus of this course.
I think this year we got, this is the first time we are having 10 one-year fellows for both regional anesthesia and as well as intensive care. I think all of you would have got very good hands-on experience in the theatre as well as in the intensive care of managing the patients, critical care patients. And thank you to all, because you are from far away places, leaving your family there, coming here and learning. I know it's a tough task, but all of you did well. You did well working with us both day and night, and I hope so that when you go out of this institute, you have learned a lot. And whenever you go for practice in any other hospital, I always advise you to start doing what you have learned with ultrasound or intensive care from the day one onwards. So that makes a lot of difference in your future endeavors. Thank you so much, and wish you all the best.
I think it was about two things. One, create a very safe perioperative environment for the patient. That was a basic thing. It should be pre-op, intra-op, post-op. The entire perioperative will be very safe period. And we wanted the anesthetists to recognize how to create a safe environment for the patients and how to go about having a safe transition from one stage to the other. The second one was, I think, very, very important as an anesthetist, even if you're not going to work in intensive care, is to recognize a sick patient when you see them. And that is unfortunately something that nobody seems to teach. And I think a very responsible role that we play is to make them understand how to filter out the music from the noise. And that is one message I always give. The noise has to go away, be it in your brain, be it in the books, be it in literature. Filter it out. Listen to the music. That really makes a difference. And I think one of the roles that we play is that, teaching them how to filter it out.
Filter the noise from the music. That's all that matters at the end of the day, right? So when duty strikes and it's on you to keep the patient away from an imminent death, what do? You gotta do what you gotta do. In Bala sir's words, just keep it simple, silly. It's always the same. A, B, C, D, E.
Wishing you all the best.